For years, Nigeria's healthcare network has been rated amongst the worst in the world. This is despite higher investure. Now, the Lancet Nigeria Commission, a multidisciplinary group of Nigerian experts and academics based around the world, over a 2-year period reviewed existing disease burden and opportunities to improve health. The team found that while Nigeria is Africa's largest economy and most populous country, the dismal health outcomes are holding back progress and threatening the future of an otherwise dynamic nation.
We have more kids under the age of 5 dying in this country than any other place in the world. And our maternal mortality ratio is only better than 3 countries, Chad, Sierra Leone, and South Sudan. Given our young population, prevention really ought to be at the heart of health policy. The case for this is absolutely clear. All of our modeling and analysis suggests for little amounts of money, as little as 400 naira, you can get several-fold the benefits in interventions such as better cooking fuels, better nutrition for our kids, and access to contraception. We need to make strong investments in public services to create a healthy population, and this has to be multi-sectoral. We have to get government functioning properly with funding, governance, communication, and accountability. We need to empower that in all settings, we have a place-based approach to deal with this wider determinants of health, and that there ought to be functional health units in every level of government.
In an accompanying Lancet paper, the group also examined population health outcomes in Nigeria between 1998 and 2019 and compared to 15 other West African countries. They analyzed by gender patterns of mortality, years of life lost, years lived with disability, life expectancy, healthy life expectancy, and health systems coverage. The experts concluded that Nigeria compares less favorable than similar nations in West Africa, despite recent investments.
Compared to countries with similar incomes, Nigerian health outcomes are really dismal. We also have huge inequalities within the country, between geographical areas, between the rich and poor, and between different parts, urban and rural settings in the country. Our aim in setting out this commission is to chart a path where we reposition health policy in Nigeria to achieve health for all. And our vision is to provide recommendations to ensure that the health and wealth of future generations of Nigerians is enhanced, and therefore Nigeria can fulfill its full potential.
Authorities here say the timing of the report is important as the country inaugurated the Health Reform Committee, which committed to universal health coverage for Nigerians, and the recommendations by the Lancet Commission will be helpful.
This report provides a number of excellent recommendations, some of which are already being implemented, but many of which we will have to carefully consider. The timing of the publication of this report is important, and I think it is particularly apt because Mr. President has just inaugurated the Health Reform Committee, which he's asked me to chair. And the committee, I believe, will benefit immensely from the input of the experts. The need to provide our people with universal health coverage led to the enactment of our National Health Act 2014. Based on this important legislation, this government and I believe future administrations are well placed to expand coverage and provide the much needed health care.
A recent World Health Organization survey ranks Nigeria's healthcare system as the 4th worst in the world. Nigerians are hoping that these recommendations, when implemented, will reduce mortality, especially for women and children who are the most affected.